Reducing the burden of cancer in Ohio. That's the goal of a statewide coalition called the Ohio Partners for Cancer Control. Christin Brown from the American Oncology Network and our own Layla Abraham are both here to discuss the coalition's work, as well as how FCPH fits into the equation. And later, it's time to Learn with Nern. Friend of the pod, Mary Nern, is back to talk about trending foods for summer, adult rec league soccer, and much more. That's all coming up on Health is Real. Come on in, stay a while. Andrew Stinson here alongside Zach Watson. The name of the podcast is Health is Real from Franklin County Public Health. Coming to you today from Memorial Hall, downtown Columbus. Zach Watson, how's it going today?
You know, I'm pretty cheerful today, Andrew. I would say cheerful. I've got cheer in my soul, and I'm happy to be here displaying it proudly.
Cheer in your soul. Glad to hear it, Zach. Well, we've got a couple of really great guests today. We have Christin Brown from the American Oncology Network, and we have Layla Abraham, OPCC coordinator, with us here at Franklin County Public Health. Thank you both for coming on the podcast today.
Thank you. Thanks for having us.
Thanks so much for having us.
You know what? Starting off, I just want to get to know you both a little bit better. Tell us a little bit about yourself, how you got to where you are now. Christin, I'll start with you.
Sure. Well, it's been a long road. I actually started off as a social worker. So my first career was in social work. I was an HIV specialist for the state of Ohio.
Oh.
I was one of the first Ryan White case managers. At that time, I think there were maybe 8 of us that covered all 88 counties for the state of Ohio. From there, I did quite a few things, fell in love with the work that I was doing, but I wanted to do more. And as an HIV specialist, I really found a passion for just the community at large and realized that there were so many deficits in the system when it came for women and children. Now, mind you, I am much older than Layla. So at that time, there were pots of money that the Ryan White program had specifically for women and children that just wasn't being tapped into. And so I worked really hard and modeled a statewide summer camp program for kids with HIV for the state of Ohio that ran for 24 years and modeled it off of a program out of California. Our program was called Camp Sunrise, and we modeled it off of Camp Sunburst. And so I just loved that. But through that, decided that I really wanted to do more. I couldn't decide if I wanted to get a master's in public health, go into nursing school, and the public health route didn't work out. I didn't get into the program that I wanted to, but I got into nursing school. And fortunately, that has just been an excellent combination, just an excellent part of my career. As a nurse, all I've ever done is oncology. And a big part of that is in community health and looking at what we can do to address cancer disparities as well as health equity and looking at cancer prevention in general.
Absolutely. Layla, how about you?
I always say that public health found me. It wasn't really on my radar. After my bachelor's degree in exercise science, I worked a bunch of odd jobs while I was looking for a job in my field. I spent some time as a waitress. I worked in a car factory. I spent some time at a winery. And a couple years after graduating and having no luck in finding a job, I decided I needed to go back to school to make myself a little bit more marketable. That's how I found the Master's of Public Health program at the University of Toledo. And truly, that changed the entire trajectory of my current career. I really knew that I just wanted to do something where I was working with people, where I felt that I was making an impact locally. And I didn't really know what public health was intimately before I started my program. And so I felt that allowed me to look at things with very fresh eyes. I was very curious. I had an incredible advisor who brought me into a lot of really wonderful work. We did lots of evaluation work together. So it really set me up for my first job outside of my master's program. And that was at the Hospital Council of Northwest Ohio in Toledo. I did community health assessments and community health improvement plans for hospitals and health departments throughout Ohio. And then in 2019, I ended up coming down to Columbus to be closer to my now husband, and that's how I started my journey here with Franklin County Public Health. I've been here pretty much ever since, and I've made my way through some of the different divisions. I started as an active living health educator. I moved into our environmental health program in 2020. I was there for 5 years, and then as of 5 months ago, I've made my transition as the OPCC coordinator. And it's just been really, really rewarding to move around in different areas through public health. I've learned a lot in those different jobs that I've had. I've met a lot of really wonderful people throughout my way. And it's really shaped me into the person that I am today. And working with OPCC is very different than where I came from before. And so I'm just continuing to learn and be curious. And I think that's a beautiful part of public health. There's so many areas that you can work for. And so it just really allows, I think, a lot of us to try out different things, which has been really fun.
Well, something I wanted to ask you, Layla, you went over your history, but I think you missed a role that you had within there, which was, I think when you were telling me about some of the odd jobs you held, that you were a mob enforcer. You've neglected to mention that. Are you trying to whitewash your history?
I don't think anyone would ever believe you that I was a mob enforcer.
That's what makes it so
perfect.
crazy.
It's perfect.
That's what makes it so crazy. You're the perfect mob enforcer. No one would ever believe it. I once upset her, and she once got really close to me, and she got in my ear, and she was just like, "There are a couple bodies at the bottom of the Olentangy that you might join. Ask me how I know." And I didn't want to ask her how she knew.
Kristen, can you believe that?
Honestly, yeah, I think I can. I got to be honest now thinking, yes.
We're learning so much today. So
Oh my
much.
gosh.
Yes. So for our listeners out there, you two are with the OPCC. Could you explain sort of what the OPCC is? Give us an overview. What's the history of it?
Yeah. So I'll start, and then Kristen, please feel free to fill in afterwards. So OPCC is short for the Ohio Partners for Cancer Control. We're a statewide coalition that have been around since the early 2000s. And what's really important to know is that each state is required to have a comprehensive cancer control program, and that's funded through the Centers for Disease Control. And that funding sets up staff that will help to stand up a coalition, and then that also to create a cancer plan. And so all states and territories in the country have a cancer plan. It is not unique. But what is very important to know is that aside from program personnel like myself and then my program manager who sits at the Ohio Department of Health, this is a volunteer-led coalition. And so we have experts from all disciplines within the oncology world come together, and they work towards the objectives of the cancer plan. The purpose of this is to leverage those experts for our collective impact to move forward the objectives in our state plan, and then our overall goal is just to reduce the cancer burden for Ohioans.
Yeah, just tying into that, I see it as it's one of those behind the scenes public health forces that most people have no awareness of. But it really quietly is shaping how cancer prevention, screening, treatment, and survivorship efforts are coordinated across the entire state. And so, we're making sure that we're not fighting cancer in silos. And we bring together public health, healthcare, and community organizations to create one unified strategy. So where you live in Ohio should not determine your cancer outcome. And I think that that's the biggest part of this is we're coming together, we're a network, we're stronger together and trying to make a difference to help move the mark with the way that cancer is impacted in the state of Ohio. It's not a single organization. I guess that's a big thing too to understand is that, we are comprised of hospitals, cancer centers, public health agencies, universities, researchers, community organizations, advocacy groups, as well as industry. So it's an amazing partnership of people all trying to address cancer disparities and cancer statistics in the state of Ohio.
And you said volunteer-led. That's an important point to talk about too.
Sure. And we're always adding members. Many of our healthcare systems are a part of this, from Cleveland Clinic to the James Cancer Hospital, the cancer organization that I work for, and the Zangmeister Cancer Center. But there are also community partners that represent the cancer support community or the Breathing Association. There are universities that are a part of this. There are pharmaceutical companies, there are insurance companies, and all of us are working together to really reduce the burden of cancer in Ohio through this collaboration because, again, just recognizing that no one system can do this alone.
And if I can chime in, I will just say, to put a number to the amount of members that we have right now, we have a little bit over 350 members, and we do have 17 topical work groups that are in OPCC. And so some of those topical work groups range from liver cancer to breast cancer, cervical cancer, colorectal cancer, delivery of patient-centered services. And so in my opinion, I think that we're very well situated, that anybody who has an interest in impacting cancer will find something that they're interested in by joining OPCC.
So, Layla, you hinted towards this earlier. This group seems like it's been around for quite a bit, given that every state has a chapter. What have some big changes to the group been recently, if you have any, or has it been sort of business as usual? Anything that you want to update people on?
That's a really good question. And OPCC over the last 5 months has gone through a huge change. That being me joining as the new OPCC Coalition Coordinator. My predecessor, Jill Price, had been involved with OPCC for the last 10 years. And so they were very familiar with her work style, her expertise. She had very intimate knowledge of all of our work groups, history of how the cancer plan began, who had been doing what. I mean, just constant knowledge of what was going on at all times in all of our topical work groups. And that's a lot with 17 independent groups running. And so while I had a very short overlap with Jill, she taught me a lot about the history of OPCC and the big players in our coalition. And so I will say that our members have been incredibly generous during my time getting my feet wet and up and running. And I'm just so grateful to work with a group of very passionate and very experienced professionals. And I will say, I mean, it's a lot to learn for me. Everyone else is learning alongside of me. And so what's been really exciting is we've had some informal listening sessions, I'll say. I've gotten a lot of feedback for what's been going really well in OPCC and opportunities for change. I'm really energized by that. I think there's going to be a lot of wonderful things that we're going to try. I know that we may fail along the way, but my philosophy is you don't get better unless you try. And so what I'm committed to is to try new things, try to bring more people into OPCC. Like Christin said, we need more awareness around OPCC, and I want to engage our members more along the way as well.
Absolutely. So tell us a little bit about what you're working on right now and any big future plans coming down the way.
Specifically, in oncology, we see patients after diagnosis. And in OPCC, the goal is working upstream, truly, across the continuum. And so when Layla talks about the groups that we have, the topical work groups, it's focusing on prevention, tobacco cessation, HPV, screening and vaccines, lifestyle changes. It's looking at screening and access to care, treatment coordination, everything from survivorship to quality of life and data and surveillance. And I think that one of the big things right now is Ohio is going through the review of their cancer control plan, looking at the state of Ohio, what are we seeing? Where are the largest areas of cancer? What types of cancer and diagnoses are we seeing? Where are the deficits? Where are the barriers? And that's where we come in to help really guide those, to help with those work plans and how we're going to address those areas in Ohio where we are seeing the most need. I mean, I guess I get so passionate about truly, access to care as well. I mean, someone's zip code should not dictate their outcomes when it comes to cancer, but yet it does. And we know that it does. And so how can we as Ohioans change that and look at where our barriers are and the areas of most need? And by coming together as a coalition, we can do that. I may have, living in Columbus, Ohio, I'm incredibly blessed with the resources that we have available to us. It's not the same for somebody in some of the rural communities. So how do we connect the dots?
Layla, I want to go back to you for this one. Obviously, you work here with us at FCPH, but how does FCPH connect within this whole big picture that you and Christin just described? What's our part in this?
Excellent question. I think as a local health department, FCPH plays an important role in contributing and carrying out the work of OPCC. A lot of what we do at the local level, like chronic disease prevention, health education, and community health assessments, directly aligns with the goals of the state cancer plan. And then specifically in my role, I kind of sit in that intersection. I help coordinate the coalition at the state level while also understanding what the implementation looks like at the local level because of my background here at Franklin County Public Health. So it really creates a two-way connection where we're bringing local insight to the state and then helping translate statewide priorities back into action within the communities. So for me, at the end of the day, it's all about making sure that the work happening across Ohio is aligned and that we're collectively moving the needle of cancer prevention and cancer control forward in Ohio.
Can I just add to that? And just tailing on that, most people think healthcare is what happens in the hospital or in the clinic. But it's public health. Public health is what has to happen before any of that. And it's what's in the background of everyday life. It's the reason that we see, how outbreaks are being contained or, that we have safe drinking water, that vaccines are available to us to prevent illnesses, and that communities are healthier overall. So truly, everything starts with public health. And I think, when public health succeeds, we take it for granted that we have all of these, safety nets built in place. And, then you have something like COVID and you realize, wow, we have a really broken system and all the fractures that were exposed because of an outbreak. And how did we handle that?
Absolutely. Absolutely. Good points. So if folks want to learn more about OPCC or join, what should they do? Where should they go?
They should visit our website, which is ohiocancerpartners.org. And if you want to become a new member, go to the top of our website. We have a new member form. Fill that out. You can choose a work group that fits for what you're most interested in. And then those will all come to me. I will give you an introduction. I'll connect you with the right people in OPCC, and you can get started with OPCC. We have just about monthly meetings with all of our work groups. So there's plenty of opportunities no matter when you join to get involved. And then something else that's really cool is we do 3 statewide all member meetings a year. And so we bring people, it's a hybrid meeting. So we bring people together, usually in Columbus in person, but we also have folks who join us from around the state who join hybrid. Just another way for us to connect as an entire coalition.
Excellent. Before we go, one question we do like to ask most of our guests is a bit of a pageant question. Zach's doing a nice pageant wave here. If you could wave a magic wand and change one thing related to public health, what would you change? Christin, I'll let you go first.
I guess it's just education for people to truly understand the impact of public health. So I'm going to get on my soapbox a little bit here.
Please do.
Okay. So every single one of us is born with what are called oncogenes. It's just a matter of what turns those oncogenes on to cause cancer. And so getting back to that, only 5 to 10% of all cancer diagnoses have some sort of hereditary component. What that means is between 90 and 95% of all cancer, it's the environment. It's where we live. It's what we eat. It's what we consume. It's our lifestyle. And that is where public health absolutely intersects with this. And I just want people to be aware of that. It's the impact that public health has on, what happens to us. I wish I could wave a magic wand and get people to truly understand the importance of public health and being able to advocate and fight for the things that we know we need, which is clean drinking water and safe environments. Again, I go back to zip codes should not dictate someone's outcome, but yet we know they do because we don't all have the same access and the same resources and the same safety nets. And so I would love for people to just understand that and advocate for more resources and support of public health and those public health initiatives.
Absolutely. I didn't know 90 to 95% is environmental. That's crazy. And it speaks to your point about public health and its importance. Layla, what about you?
If I could wave a magic wand, I would say free healthcare for everyone. I mean, us as public health professionals, we see time and time again the impacts of folks who are unable to get the care that they need because they're either underinsured or uninsured. And it's no secret that medical care in the United States is expensive. Mm-hmm. And so, I mean, speaking from experience here, it's really heartbreaking to see when you have a loved one who's extremely sick and all of a sudden you have to pump the brakes and care has to stop because either A, the recommended care by their care team is too expensive. B, the health insurance decides we're not going to cover that actually. Or C, it's just too hard for folks to navigate the system. And I think it's hard enough today in our fast-paced lives to get the care that we need to stay on top of our medical appointments and to actually understand when you're faced with a very big diagnosis like cancer, for example, to wade through all of that and then have all of the additional barriers. And so for me, I think that would change a lot of outcomes for a lot of people, and it shouldn't be as difficult as it is. I'm so passionate about that. And truly, as a public health professional, you see the barriers and the deficits in healthcare every single day. And it's just something that is always on my mind. And I feel like if I could wave a wand and I could say, you all have free healthcare, that is one less thing for you all to worry about. You don't have to find transportation. You don't have to find folks to watch your kids. You don't have to worry about the medical bill that you're going to get. Talk about the burden that would be lifted off of everybody.
Yeah. And, I think that's a great thing that you highlighted. I think both of what you brought up, it's very much, all of that is very much needed. And I just want to say that, I know that the topics that we're talking about today, I mean, cancer especially, it's heavy, it's a heavy topic. I'm somebody someone in my life just has been going through cancer and stuff like that. So, for that reason and for many others, I just appreciate everything that you all are doing and the coalition's work. And, I'm hoping that, other people find out about this and appreciate what you're doing too.
Absolutely. Zach, any other questions about Layla's involvement in the mob potentially?
Wait, what's that? I'm sorry. She just whispered in my ear to watch my car. So I've got no questions. I've got no questions.
All right.
I fear for my life.
Okay.
I've got my eyes on you.
Okay. One more time, what's the website people can go to learn more and become a member?
OhioCancerPartners.org.
Excellent. Well, Christin Brown with the American Oncology Network and Layla Abraham, OPCC coordinator here with Franklin County Public Health. Thank you both so much for coming on the podcast today.
Thank you.
Thanks so much for having us.
And now our fun segment called Learn with Nern, featuring healthy food expert Mary Nern. Zach, let's hear that intro.
Do not set yourself on fire.
Learn with Nern. 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 Learn with Nern.
Put the sharp object down.
How to use a map. Learn with Nern. How to build a rocket.
Absolutely not.
How to get rich quick. Learn with Nern. Avoiding cults.
Really?
And don't get sick. Learn with Nern. How to build a table out of wood. Which restaurants are real good?
No.
Learn with Nern. You gotta learn with Nern. Learn with Nern. Learn with Nern. Learn with Nern.
This is why your dad's disappointed in you.
Learn with Nern. Learn with Nern. Learn with Nern. Learn with Nern.
Why would you do that?
Learn with Nern. Hey Mary, what are some trending fruits and vegetable for summer? Is that what season is this, Andrew?
Well, we're getting into summer. We're getting into summer soon, I think. So,
I was just in Miami, so it's summer.
It's summer. All right. So what are some trending fruits, vegetables, foods for summer that you want to let the people know about?
Dragon fruit might be trending because
Ooh.
everybody's on fiber right now.
Mm.
There's a lot of fiber in dragon fruit.
Is that right? Okay.
Yeah, in the seeds, in the middle. So that's what I'll go with.
Why fiber? Do we know why fiber is particularly trending? Or
because people are trying to overcorrect for the emphasis that has been on protein. And then also I think there's been a spike in people like in their late 20s and 30s diagnosed with colon cancer.
Mm-hmm.
And fiber is good for a healthy colon and digestion. So yeah, we've realized we're protein maxing and we should be fiber maxing.
Interesting.
Both maxing maybe.
Both maxing.
Both maxing. But fiber helps break down the food that you eat. So you need a good amount of it.
All right. I love it. Okay, so
Great.
dragon fruit.
Dragon fruit.
All right. Now, what fruits and vegetables and foods do you hate? Wait, what's down? What's going down, Mary? Tell us.
Oh,
talk your trash. Speak your truth.
Talk for myself or talk for society?
Both.
Okay. I'll hate on meat. I'm vegan. I find meat to be disgusting. And that's personal for me. And let's see, other foods I hate. with that being said, I also hate beans. So
What? Whoa.
I'm not a big bean gal. I just don't like the texture, but I like legumes. So yeah, and I'll eat them out of necessity.
I was gonna say because for vegans, beans are a big thing. I have a friend who, we were talking about. My friend loves Taco Bell as a vegan, and so naturally, one of our friends was like, "I'm sorry, what is on the Taco Bell menu?"
It's actually the easiest place to eat.
It is,
fast food wise.
It is. That's what they told us, and my other friend did correctly guess. It's so beans, and my friend was like, "Yeah, beans."
And actually, Taco Bell's black beans, I don't mind.
Yeah,
it's probably because they're horrible for you, but
I think they season them really well with something. I actually cooked black beans the other night and put garlic, pepper, and then chili seasoning in them because, like, I like black beans. The texture doesn't bother me, but they are kind of like at the end of the day very bland, and so it's just like I just need a little bit of something in there.
And they're dry. Like a black bean burger, I will never touch. I don't care if it's homemade. I don't care if it's made by a chef. I'm not going to like it because I just think it's a texture and they're dry and I don't know, not my favorite.
Yeah.
But I see the value in beans and encourage others to eat them because they are very good for you.
Mary frowning on mic right now as she's forced to talk nice about beans. On our first Learn with Nern segment, I want to shout out Mary. Mary is the only person here that I know of in Ohio who knew or knows of Erewhon. If you don't know what Erewhon is, it's an LA-based grocery store, lifestyle brand, and I think cult. Could be all of those things all at once. But you properly identified blue spirulina, I believe it is, as a trending thing. And ever since that Learn with Nern segment, it is blown up and it is everywhere. Smoothie King, you're just everywhere. I saw it I don't think I saw it at a Dairy Queen, but I saw it at an ice cream stand somewhere.
It's all because of your appearance on our podcast, too, by the way.
It is.
Yeah.
And it's all to even back that up further because I'm chronically online. So there's no problem with that, is what I'm saying. And everyone's trying to be Erewhon, I think. Everyone's trying to make Erewhon smoothies.
Okay.
Yeah.
Because at this place also blew up in Upper Arlington, the like really fancy market that's like ridiculously expensive. But it's a great vibe. It's close to where their farmers market is, and there's like a bookstore in the Littleton's. Littleton's Market has Erewhon-esque smoothies. And I don't know if it's because they have seen people are calling them the Erewhon of Ohio, or if it's because they made the smoothies and now they're the Erewhon of Ohio. Chicken or egg situation. But if you want to try one without going to LA, go to Littleton's.
And it's funny because if you talk to an actual LA-based person, Erewhon doesn't always have like the best rep because they're kind of like snooty and rude, depending on what your vibe.
Let me say it's a vibe if you're feeling like you want to feel wealthy and you aren't. Like it's like I'm cosplaying a wealthy person by going here, and I'm getting the cheapest thing on the cafe menu.
Yeah,
but I'm here, so I'm one of them.
Yeah, so yeah, I love that. Yeah, I like cosplaying like I'm wealthy.
Yeah,
it's fun every once in a while.
Yeah, Zach thinks I'm wealthy too, so
you summer vacation on Cape Cod.
Oh, that's
Martha's
a wealthy
Vineyard.
person thing. That's a wealthy person thing.
It is.
Most people I know go to Myrtle Beach.
Yeah,
that's true. A lot of people do go to Myrtle Beach.
No hate at all.
All the poors go to Myrtle Beach.
Jesus Christ.
Poverty Myrtle Beach.
Yeah. I'm sorry, your name is Andrew Stinson Kennedy?
That's Rockefeller. Rockefeller, yeah.
Yeah. How are the oyster bars out there, Andrew, in Martha's Vineyard?
They're okay this year. Yeah, it could be a little bit better. Hopefully, summertime will.
The other half lives really nice, don't they?
Yeah, I'm just gonna lean into this.
You got stock options. Mary, we want to learn what's making you happy out there.
Oh, I've been playing adult rec league soccer, learning that my competitiveness has not gone away, which is very embarrassing because I get really mad during adult rec league soccer games, and I don't want to be that way, but I am.
I also played adult rec league soccer. I was an attacking midfielder. I had a fun time. I was still fast at that point in my life. This is just a couple years ago, but things have really slowed down now. I was still fast. And so that was really fun.
Yeah.
I could still do stuff with the ball. Someone kicked the ball to me. I had one really nice moment. I joined a team who needed a fill-in for a couple games at the end of the season, and someone had launched a ball And I I play with a soccer ball just for fun. Like I'll go in the backyard sometimes and like just do it for fun. But I hadn't played in so long, and someone launched a ball, and I was able to take my foot, put it in control, and kip it behind me all in one move. And there were two guys on the sideline. They're just like, "Good move," and I was just like, "Yes, still got it!" Like, yes. And then I didn't do anything the rest of the game.
No, I'm like, and I've said this explicitly, if you don't play the ball to my feet, I'm not getting to it.
Yeah.
So when I tell you to play it to my feet, play it to my feet.
Yeah.
And then I play with my brothers, which has also been a very interesting learning experience because Paul and I, personality-wise, are very similar. Mm-hmm. And so he'll tell me one thing, and I'm like, well, someone has to do it. Instead of just being like, that was constructive feedback, I'll get to it. Like, I don't know. And he's not that way with me. So it's bringing up some family dynamics for me.
Yeah.
That I realize I need to work on. But it's fun. If you ever want to sub, I'll have to hit you up.
Oh my God. I have to get in so much better shape.
No, you don't.
Give me months.
You don't. Because I agreed to start playing in what I thought was a summer league, and it started in April. And I had said, like, I'll play in March. And then it was like, starts next week. And I was like, oh no. And this was outdoor. So it was like,
oh God. Worse.
But it's slower paced than outdoor.
It is.
So it's not as bad on the body.
Real grass, right? And
yeah.
then the outdoor. Okay.
Mm-hmm.
Yeah. The indoor, whether it be AstroTurf or like just court or whatever it is, it's just so much faster and that sort of thing. So similar to how some celebrities, whether at McDonald's or wherever else, have their own specific meal, if you could pick a sort of fast food or fast casual, or even let's say a restaurant, like it could be like a chain restaurant, what restaurant would it be? Like what food place? And then what dish like would be your custom Mary Nern meal?
Oh, I like this question. Okay. Yes. I'm going to fantasize for a minute and pretend that all of these things, like that the US fast food scene has the same options that the UK and like every other country has for vegans, as far as like the fake meat, which is what I want. I don't want beans. I want fake meat if I'm going to fast food. It would be Taco Bell. And it would be, they had for a while here, like a vegan alternative to their nacho cheese. And typically I find those alternatives to be disgusting, but this was actually flavor-wise the same profile. It was a little bit different texture-wise, obviously, but it tasted really good. So it would be a cheesy gordita crunch with that instead of cheese in the shells. And then Impossible meat. I would add potatoes, and then I would hope that they have like a non-dairy version of their chipotle sauce, lettuce, onions, Fiesta strips. Either the jalapeno or the chipotle, one of the two would be in there, and that's what it would be with the G2.
Now, they always do. I'm gonna go a step further here. They always do a commercial for their special meal. Like, what would your commercial be?
It would be.
We pan in.
Yeah, myself and all of my friends sitting on my Aunt Vicky's vintage green velvet couches that I now have in my house. We'd be sitting around, it's 3 a.m. and there's 40 of these cheesy gordita crunches and we're just housing them.
I love this.
Yeah.
I love this.
With like Sabrina Carpenter on or something in the background. We're watching Dance Moms. I hate to bring it up again.
Yeah.
But we're watching Dance Moms.
We're coming full circle with Dance Moms.
I do hate to say that's probably what would be on the TV.
Taco Bell, call us.
Yeah. Get Impossible meat on the menu.
Andrew, do you and your rich family know anyone from Taco Bell? Not like employee, but like, higher up, like not fast food employee.
I'll have to check. I'm sure somewhere along the line someone is. So I'll have to, and we can get this on the menu.
Yes. Do you, and I assume the Bezos family that you know so well, good family friends, do you guys know anyone?
It's actually pronounced Bezos. I don't think anyone really knows that.
Boy, I'm mad. That angered me. I don't know why.
You got beat at your own game.
Don't like. So last question. Is there anything that you want the audience to learn?
I think keep it simple, follow your heart, and that's it.
And watch Dance Moms.
I was going to say, I really want it to be a thing about Dance Moms.
That's kind of understood. I'm following my heart. I'm watching Dance Moms, and you should be too. There's absolutely nothing to learn from that show, and that's why I love it.
and we love having you on the podcast. Learn with Nern.
Learn with Nern. Can we do applause for real? Not on the board. Not on the board.
Not on the board. Hey!
Yay. Not on the fake audience.
Oh, I was like,
Hey, the audience is here too.
There's one guy in that recording that's going really hard. I love dance moms.
Thank you for listening to the Health is Real podcast from Franklin County Public Health. We want to hear from you. Email us your thoughts at fcph@franklincountyohio.gov, and we might respond on a future episode of Health is Real. And also be sure to follow FCPH on all social media platforms for the latest updates.